Okay, well, thank you everybody for joining my session today. My name is Amy Webb. I am one of the subject matter experts on the NHSN Antimicrobial Use and Resistance Module team. And today I'll be presenting the NHSN Antimicrobial Use and Resistance, or AUR, module reporting for the CMS Promoting Interoperability, or PI program. So for the rest of my presentation, I'll be abbreviating the Promoting Interoperability Program to the PI program, or sometimes the CMS PI program. I do want to point out that the slides that are posted in the annual training website are slightly different than what I'll be presenting today. Sorry about that. We'll be posting the revised version of the slides as well as the recording, hopefully by tomorrow. So there are some slides that are different than what you have in the version you have. Again, we will be posting a corrected version, ideally by tomorrow. Largely, the changes are based on some discussions we've had with CMS based on the feedback we've been hearing from facilities, mainly around creating the test files. So we'll get into all of that in the next few slides. Okay, so my objectives today are to provide a brief overview of the CMS PI program, as well as the NHSN AUR module. I will describe the data that are reported into the module and the mechanism for reporting those data, outlining the steps for meeting the AUR measure requirement within the PI program, and summarize the answers to some common questions we've been getting. The slides and the answers for today are based on the details in the CMS final rule, which is very, very long, but also CMS has published a AUR reporting specification sheet for calendar year 2024, so you can get that link directly on this slide as well. Okay, first off, what is the CMS PI program? So the PI program requires eligible hospitals and critical access hospitals to report on objectives and measures to be considered a meaningful electronic health record, or EHR, user and avoid a downward payment adjustment. So the PI program has been in existence for many years. It was previously known as the Meaningful Use Program and was renamed to Promoting Interoperability. And you can see here on the screenshot of the slide, I have the list of all the 2024 measures and objectives. So in the red box, you can see where AUR reporting fits in the PI program, but there are lots of other data reported in the PI program as well by your facility. I've also posted the link on this slide to get directly to the CMS PI program webpage. Okay, so how do facilities find out if their hospital participates in the PI program? So most acute care hospitals participate in the PI program. So we recommend reaching out to the people that are in charge of the quality reporting within your facility, and or sometimes that might be in your C-suite to figure out if your facility participates in the program. Somebody should know because there are dollars associated with participation in the program. And as a reminder, critical access hospitals are eligible to participate. So just because you're a critical access facility doesn't mean you're automatically excluded from this program. Just a few notes on who is not included in the program. Long-term care facilities, also known as skilled nursing or nursing home facilities, are not eligible to participate in the PI program. And there are also other types of hospitals that provide inpatient care that are not included in the PI program. So that includes inpatient rehab, inpatient psych, long-term acute care hospitals, and newly added to the slide, rural emergency hospitals. So we got clarification from CMS that rural emergency hospitals are not included in the PI program and therefore will not be required to participate in the AUR module as part of that program. So let's look at it in a different way here. In this figure, you can see we have a group of facilities that NHSN accepts AUR module data from and that are eligible for the PI program. That includes acute care hospitals and critical access hospitals. There are no facilities that are eligible for the PI program, but we don't accept their data from. So that you'll see a none in that square. And then We have a handful of facilities that can report AUR data to NHSN, but are not eligible for the PI program. That includes the rehab, psych, LTAC, and the rural emergency hospitals. And then the last square are those facilities that are not eligible for the program, but also not able to submit AUR data into NHSN. Those are the non-hospital facilities, the outpatient dialysis clinics, the ASCs, and the long-term care facilities. Okay, perhaps the question you're most interested in, are AUR module data required for the PI program? And if so, when does that start? So yes, the AUR module data are required for calendar year 2024 under the Public Health and Clinical Data Exchange objective of the PI program. So again, that applies to eligible hospitals and critical access hospitals that participate in the program. And it's really important to remember that for CMS purposes, this measure includes submission of both AU and AR option data. Historically, and in NHSN, you'll see that there are two separate options, and we've often said you can do one or the other. They're not related or they're not tied together, but for the purposes of the PI program, you have to do both. Okay, so for 2024, facilities are going to attest to either being in active engagement with NHSN to submit their AUR data or claim an applicable exclusion. So we'll talk about what both of those things mean, active engagement and exclusions, in the next few slides. First, let's talk about what active engagement means. So there are two ways to be in active engagement. The first, option one, is pre-production and validation. So to start that option, you're going to complete the registration of intent within NHSN. So that's a single screen that indicates that your facility will be submitting AUR data. We'll talk about that in a later slide. And edited here from the version you have, the slide deck you have, you must be working on the testing and validation of the CDA files. So working towards the creation of those files during the calendar year of 2024. Or the next level up is option two, validated data production. So you still have to complete that registration screen within NHSN, and then you move towards the submission of production AU and AR files to NHSN. For 2024, it's 180 continuous days of AUR data submission, also known as the EHR reporting period, but we'll cover that again a little later in the presentation. Just a quick note here, the definitions of active engagement are set within the PI program, and these definitions are the same as the other measures also in the Public Health and Clinical Data Exchange objective. So the option one, option two things should be familiar to you, to your facility, if you're already participating in those other measures within the PI program Public Health objective. And an update from CMS on the active engagement definition. Starting this calendar year, facilities can only spend 1 year in option one. So as an example, if facility A attested to option one, pre-production and validation for 2024, then facility A must move to option two, validated data production for 2025. However, facilities can move to option two as soon as you're ready. So you don't need to do option one in 2024 if you already have your AUR data production ready. You can skip option one and just go right to option two. Okay, so some of you may be asking, what is AUR? So AUR module provides a mechanism for facilities to report and analyze their antimicrobial use and resistance data to inform their benchmarking, reduce their antimicrobial resistant infections through stewardship, and interrupt transmission of resistant pathogens at your facilities or facility networks. So the AU option, our numerator is antimicrobial days, also known as days of therapy. And then we have the denominators of days present and admissions. Whereas for AR option, the numerator is isolate level susceptibility results. And for the denominator, we get patient days, admissions, and encounters. So we'll go into a little bit more detail on all of those in the next few slides. Are patient level data collected and or shared? So no patient level AU data are shared with NHSN. The data are aggregated to the month and location, also known as the unit level, and to the facility-wide inpatient, also known as FAC-wide in NHSN speak. So we don't get any patient-level AU data. So we don't have dose, duration, or indication, any of those patient-specific things. We do not get in NHSN. So we get the aggregated counts by month. So as I mentioned earlier, we use the antimicrobial days or days of therapy as our numerator, which is just the sum of days for which any amount of a specific agent was administered to a patient. For 2024, we have 96 different antimicrobials, which includes antibacterials, antifungals, anti-influenza, antiviral, and one monoclonal antibody agent. Those 96 agents are stratified by route of administration. So IV, IM, digestive, which includes any administration from oral to rectal into the digestive tract, and respiratory. So those are your inhaled antimicrobials. The important thing to remember from the AU data on this slide is that NHSN only accepts administration data that come from the Electronic Medication Administration Record, or the EMAR, or the Barcoding Medication Administration Record System, the BCMA. So we do not accept pharmacy orders or pharmacy billing data, for example. On the other hand, yes, we do get patient-level AR data. So the AR event is an isolate-level susceptibility result for a specific organism. So we have 4 criteria that must be met for an individual isolate to be considered an AR event. So first, it has to be collected in an eligible location or unit. So that's all inpatient locations, as well as 3 select outpatient location types: the emergency department, pediatric emergency department, and the 24-hour observation unit. The isolate must be collected from one of 4 specimen types: the invasive specimen sources of blood and cerebrospinal fluid, and the non-invasive specimen sources of urine and lower respiratory. Third, an eligible organism must be identified. You can get the full list of eligible organisms in our NHSN Antimicrobial Use and Resistance Module protocol. But you'll see when you look at that list, the organisms on it are some of the most common found in healthcare settings, as well as some less common, but you would certainly want to know about if they pop up in your facility. And lastly, antimicrobial susceptibility testing must be completed on the isolate, but the isolate qualifies for submission regardless of the susceptibility results. So if you had an isolate, let's say it's an E. coli, and it was tested against 3 drugs and all 3 were susceptible, that still counts as an eligible AR event, even though all 3 results were susceptible. All right, pivoting a little bit, what denominator data are submitted? So for the AU option, we collect the days present and admissions denominators. So days present is the number of days during which a patient spent any time in a specific unit or facility. So again, this is reported for all of your individual inpatient locations and your FAC-wide in, as well as 3 select outpatient locations, the ED, pediatric ED, and 24-hour observation area. It's important to remember that days present is not the same as patient days. Days present, as you can see in the definition here, the patient gets counted if they spent any time in the unit or facility, whereas patient days is the once daily census count. So you're only counting the patient where they are at the time of the once daily count. And for admissions, our second denominator, that's just the standard number of patients admitted to an inpatient location in the facility. That's reported for FAC-wide in only, and we use the same definition for the AR option. And then for the AR option, we get patient days, admissions, and encounters. So patient days you're probably very familiar with, the number of patients present in the facility at the time of the once daily census. That's reported for the FAC-wide in only, and is the same definition used in HAI reporting. Admissions, again, I won't repeat myself, but it's the same definition as used in AU reporting. And then lastly, encounters is counted as a visit to an eligible outpatient location. And again, that's reported for the outpatient locations only, the ED, pediatric ED, and 24-hour observation area. Okay, so what is the reporting period for the CMS PI program? And do I need to be reporting AUR data into NHSN now? Great question. So the EHR reporting period is important to understand here. So each facility designates their own EHR reporting period. So NHSN cannot tell you what your reporting period is. Your facility designates your own reporting period. So for 2024, that's a minimum of any 180 continuous days. And it's important to remember that AU and AR data must be reported for the same 180 days. So just some examples of the 180 days could be anything, January 1st through June, April 1st through September, July through December. So it can really be any 180 continuous days set by your facility. So how can NHSN users find out their facility's EHR reporting period? Again, that's designated by each individual facility. So if you're not sure what the reporting period is, we'd recommend reaching out to the people that are in charge of the quality reporting within your facility and or potentially in your C-suite. Specifically, we might recommend checking with the person who has access to the CMS Hospital Quality Reporting or HQR system, who may have additional insight into your hospital's PI reporting, since that system is what's used for the PI reporting and attestations. Okay, let's switch gears a little bit and cover what hospital software systems should these data come from. Now, AUR data should come from electronic sources only. So we've already covered the fact that AU data must come from the administration systems of the EMAR and BCMA. And the denominator data, you're going to get those from the admission discharge transfer ADT systems. The AR data are going to come from the LIS or maybe the EHR system. And the denominator data, again, you're going to use the ADT data. The most important thing to remember here is that no manual data collection or data entry is allowed for this type of reporting within NHSN. All right, so let's talk about the exclusions for the AUR measure of the PI program. Right now, we have 3 exclusions for our AUR measure. So the first one does not have any patients in any patient care location for which data are collected by NHSN during the 180-day reporting period. So that probably doesn't fit many of you. That would be perhaps if there was a natural disaster or large-scale construction going on where your whole facility was closed during the 180-day period. The second exclusion is that the facility does not have EMAR or BCMA records or an electronic ADT system during the reporting period. So that applies mainly to the AU data. And then the third exclusion is does not have an electronic LIS or electronic ADT system during the EHR reporting period. So that refers to the AR data. So we have some notes on the exclusions because we've gotten a lot of questions about them. So ultimately, NHSN can provide guidance, but CMS must decide whether a specific scenario meets the exclusion criteria. The exclusions are reported in the CMS HQR system, submitted at the same time as the attestations or other data are reported. So that's during the HQR open period, also known as January 1st through the last day in February each calendar year. So exclusions for calendar year 2024 will not be reported into the HQR system until January and February of next calendar year 2025. So hospitals claiming an exclusion on AU or AR would claim an exclusion on the measure as a whole. So if you meet the exclusion criteria for AR data specifically, CMS does not expect you to report AU data into NHSN. You are excluded essentially from the measure as a whole. However, NHSN would encourage you to report the data that you have available. So you may claim the AR exclusion and therefore not be required to report AU data to NHSN, but we'd highly recommend reporting the AU data you have available to NHSN so that you can take advantage of all of our great reporting metrics and risk-adjusted comparisons. If the hospital does not have access to discrete results for all the eligible organisms as outlined in the protocol, the hospital may claim an exclusion for the AUR measure. And again, while the exclusion specifically mentions electronic LIS and electronic ADT, the exclusion related to the AR data, we and CMS encourage you to claim the exclusion that's closest to your hospital situation. So for example, if you do not have discrete access to the results, let's say you send some isolates out to an external lab and those results come back to you via PDF or a fax or a blob of text in the comments field, perhaps. Those are not discrete results, and therefore you may be able to claim the exclusion, specifically related to the AR data. The most important part to remember is that the PI program, the goal is interoperable access to available data. So if you don't have interoperable access, like you can't reuse essentially the data that are coming back from that external lab because it's in a fax, for example, then that's not interoperable, and therefore you would need to claim the exclusion. Okay, let's talk about some examples. And we're going to use Candida since that's the most common organism type asked about in our previous presentations as well as on the NHSN Help Desk. So in example number 1, let's say Candida isolates are sent out for identification and or antimicrobial susceptibility testing, or AST, and returned to the facility via PDF or fax. Then the facility does not have interoperable data and should claim the exclusion for the PI program measure. But in number 2, if the Candida isolates cannot be speciated, then those isolates are not eligible for the AR reporting. So the data just don't exist. So the facility should not claim the PI program exclusion in that case, because you can't speciate the Candida isolates, and part of the NHSN requirements are that are only for specific Candida species to be submitted. So in the example number 2, you would not claim the PI program exclusion, and you would just submit the data for all the other organisms that you have available. And lastly, number 3, if Candida isolates are speciated but do not have AST performed, then those isolates are also not eligible for AR reporting, and the facility should not claim the PI program exclusion. So again, as one of the requirements for being an eligible isolate was that AST has to be performed. So these Candida isolates that do not have AST performed are not eligible to be reported to NHSN. Therefore, you would not claim the exclusion and just report the other data you have available. All right. Will hospitals be expected to separately attest to meeting reporting requirements or exclusion criteria for AU and AR? No, as mentioned earlier, AUR is a single measure for the PI program. So you can't get partial credit for reporting either AU or AR. So if your facility isn't in active engagement for both AU and AR, then you have to have an applicable exclusion, or your facility would have to report or attest no. And attesting no means the facility would not get credit for the AUR measure and would fail to satisfy the public health and clinical data exchange objective. Most importantly, as bolded on this slide, failure to fulfill any of the required measures, including the AUR measure, would result in a score of 0 for the Promoting Interoperability Program, and facilities could be subject to a downward payment adjustment. Okay, let's talk about how these data are submitted to NHSN. So as I believe I've mentioned already, the data are submitted via Clinical Document Architecture, or CDA files. So there's just way too much data to be manually hand entered. So for the AU and AR option, the data are required to come into NHSN in this format via CDA file. CDA is a Health Level 7 or HL7 standard, and it essentially just provides facilities with a standardized way to package and upload their data into NHSN. So we use CDA exclusively for AU and AR, meaning you cannot manually hand enter anything. But also, some of you may be using CDA files to upload your HAI events, for example. It's very important to remember that CDA is not the same as CSV. CDA uses extensible markup language or XML coding. I have a screenshot of a very tiny piece of the AU CDA file here on the slide. And as you can see, it's not something that you'll be able to pick up over the weekend. It requires some very in-depth knowledge of XML coding as well as HL7 structuring. So we recommend using a software vendor. So the vast majority of facilities use a commercial software vendor. That can be either your EHR vendor or a surveillance software vendor. But as required in the PI program, you have to use Certified Electronic Health Record Technology, or CERT, that has been updated to meet the 2015 edition Cures update as outlined in the ONC standards. Additionally, vendors must also have met the NHSN validation standards. So NHSN has their own type of validation, which we'll cover a little bit later in the presentation. And you can see the links on this slide for AU and AR, those vendors that have been validated to meet our validation standards. So who needs access to NHSN for this reporting? So we recommend either the pharmacist or physician champion, ideally 2 AUR specific users within each NHSN facility. So this can be the pharmacist or physician champion in charge of uploading data, reviewing and validating submitting data, and running reports and analyzing data. But each facility makeup is a little bit different. So if in your facility, the infection prevention and control folks will be uploading the data, you may only need 1 AUR specific user. However, we highly recommend 2 AUR specific users so that if one person goes on extended leave or is out sick, for example, there will be another person who knows what's going on in NHSN and can answer any questions or reply to NHSN emails in a timely manner. So how do I get access to NHSN if I'm, for example, the pharmacist that will be in charge of this reporting? So first, talk with your infection prevention team. So your facility is already enrolled in NHSN and reporting your HAI data. The infection preventionists are kind of the keepers of NHSN in the vast majority of facilities. So you'll want to reach out to them to gain access to your NHSN facility. We have a very helpful document that highlights varying levels of user rights that an AUR user must have in order to complete their duties, linked here on this slide. So if you are the pharmacist, you can send this document along to your NHSN facility administrator and kind of talk through what access will be right for your facility situation. Once that new user, those 2 new users are added to your NHSN facility, you're going to need SAMS credentials. So SAMS stands for Secure Access Management Service, or SAMS, and essentially provides secure access to NHSN. All NHSN users must have SAMS credentials, and most importantly, they are user specific and cannot be shared. They are for 1 user only. The process is completed just once per person, though, regardless of how many NHSN facilities you have access to. So if you are a user at a health system, and maybe you'll have responsibility for overseeing, let's say, the 3 hospitals in your system, you'll only have to complete the SAMS process just one time, as long as you use the same email address for each of those 3 NHSN hospitals, for example. The SAMS application process can take a few hours or a few weeks, depending on which route you take. Essentially, you can upload documentation or you can mail in documentation. So as you can imagine, the mail-in process takes longer. All right, so what do facilities need to do to meet the AUR reporting piece of the PI program? So we have some prerequisites. So first, you're going to figure out your vendor situation. So as we've already mentioned, the vendor has to be certified by ONC and listed on their Health IT webpage. And in the bonus slides at the end of the deck, it walks you through how to find the specific part on the ONC Health IT webpage for AUR vendor. So check out those bonus slides. excuse me, and also the vendor has to be validated by NHSN and listed on our synthetic dataset or SDS web pages, as I've already mentioned. The second step is to review the quick reference guide. So that highlights a lot of these same steps, but in a little bit more detail. And number 3, determine if your facility has done any of the following steps already. So we have over 3,000 facilities that have already completed step 1, registration of intent. So if your facility already did that, you can move on to step 2. Okay, step 1, registration of intent to submit your data. The most important part about this slide is that only the NHSN facility administrator can complete this step. So after logging into NHSN, the facility administrator will click Facility on the left-hand navigation bar, then click AUR PI registration, as shown in my screenshot. Then you'll get to this registration page. On that page, you can add up to 2 additional email addresses to receive the monthly AUR submission reports. Some important notes about registration. So first, the registration can be completed only one time ever and cannot be undone. So as I mentioned, the AUR has been a part of the Promoting Interoperability and previously the Meaningful Use Program for many years. It's possible that your facility completed the registration last year, 3 years ago, maybe. That's okay. You cannot redo it. If you did it accidentally too early, it cannot be undone. Okay. So if it's already been done, you can move on to the next step. You don't need to worry anymore about the registration. Number 3, the registration will immediately kick off the request to send test files for validation. So we'll talk about that in the next few slides. Number 4, if you cannot see the registration page in NHSN, that means you are not the facility administrator. So we get that question often. If the person that's listed as your facility administrator has left the facility, you can follow the steps at this link to get that role reassigned. Or if you thought you were the facility administrator, but you can't see that page, you can reach out to us and we can help you determine who your NHSN facility administrator is. And lastly, number 6, the completing the registration screen is not the same as the attestation. So there's no way in NHSN to designate whether your facility is going to do option 1 versus option 2. That's reported in the CMS Hospital Quality Reporting or HQR system. So the registration in NHSN is just essentially clicking the button that says, yes, I register intent to submit AUR data. Okay. Then you're going to move on to step 2, testing and validation of your CDA files. So after you complete the registration, you are going to work towards generating files with your vendor system. So after you complete that registration, you may be very ready to start submitting production AU data. You may be a lot less ready. Maybe you're just getting on board with a new vendor software and you're still going through the validation steps, for example. Essentially, for this calendar year, after you complete the registration, if you're going to attest to option 1, you're going to work towards generating those files in your vendor system. If you have the files ready, or as soon as you have the files ready, you can send them to NHSN for validation. For that purpose, we need one file for each type, AU, AR event, and AR summary. So many vendors have these files available for you to use. So before you spend too much time trying to figure out what they are, please ask your vendor contact for them. It's important to remember that while we ask for test files, meaning fake data, and we do prefer test files, if you're not able to generate files with fake data, that's okay. You can send us your production data. However, in the event you do that, you need to send them via secure email because that AR event file will contain patient information. So if you're sending real data for the purposes of the validation step, please send them via secure email. And you're going to send those to the NHSN CDA at cdc.gov mailbox. So some important notes about the test files. So first, please send a new email or open a new ticket with the test files. So if you're if you're corresponding with us about some other questions related to the PI program and you get all your answers and you have your test files ready, please send them in a new ticket instead of sending them on an existing ticket. That just helps us keep better organized. Similarly, for number 2, send one email or ticket per NHSN org ID or facility. So if you're, for example, in a hospital system and you have, let's say, 3 hospitals, it would help us tremendously if you send one email per NHSN hospital or org ID. Don't send all of your files from multiple facilities in one email. That makes it extremely challenging for us to keep track of. Please be sure to send all 3 files. So if you'd like a letter saying that you've completed the validation step from us, then you have to send all 3 files. And that's even if you're already submitting production AU data. So we have many, many facilities that have already been submitting production AU data for quite some time. If you're planning to attest to option 1 for the PI program for 2024, and you want a letter saying you've completed validation, you have to send us the AU file in addition to your 2 AR files. And lastly, number 4, please send them as separate XML files and not a zip file. So with our ServiceNow system, it strips zip files from your email. So you'll send us the email, we'll get the email, but we won't get the attached zip file. So please send them as separate XML files in your email. One of the important points to remember is that if your facility is already submitting production data, or if you plan to submit production data for calendar year 2024 and attest to option 2, then you can skip the test file step. And then step 3, submission of production data. So for those of you that plan to attest to option 2 for 2024, you will be sending your AUR production data to NHSN on an ongoing basis or monthly during your 180-day EHR reporting period. NHSN will automatically email the NHSN facility administrator, as well as those optional contacts, a monthly report outlining their data submission status. That'll look like the screenshot on the bottom of my slide here. It'll just show by month and by file type, a yes if we've received any of those file types, or a no if those files have not been received for the month. And some important notes about the production data. So again, facilities should upload their data on an ongoing basis during your reporting period. Facilities can report for months beyond your 180-day reporting period. So let's say your facility's 180-day reporting period is January through June, you can continue reporting, and we would encourage you to continue reporting your AUR data beyond that 180-day period for the rest of the calendar year, for example. And number 3, while the attestation in the CMS HQR system is completed at the hospital level, NHSN encourages facilities to submit your AUR data from all the inpatient locations individually, FAC-wide in, as well as those select outpatient locations that I've mentioned earlier. If you don't have all of those locations mapped in your NHSN facility, we recommend working with your infection prevention team to review and/or map any of those additional locations. So if my hospital uses a validated vendor, does that change the requirements? No. So using a validated vendor does not change the requirements for you. So if you're attesting to option 1, pre-production and validation, you are going to work towards creating and sending those test files in calendar year 2024, regardless of the vendor that you have to submit the AUR data. And as previously mentioned, if you're planning to attest to option 2, validated data production, you don't need to send those test files for validation. Let's talk a little bit more about the different types of validation. So number 1, data quality validation. This is what we consider just your basic validation. So it's conducted by the facility and or the health system. It validates that the data are accurate and complete. So for example, you have the correct number of vancomycin antimicrobial days being reported for your medical ICU, for example. And we have AUR validation materials that are posted on our website that will also be covered by Laura in her presentation tomorrow. So tune into that. But ultimately, you do not need to share the results of this validation with the NHSN AUR team. We're happy to help you troubleshoot if you run into issues or you find anomalies that cannot be explained. We're happy to help you with those, but you don't need to share those results with us. The second type of validation is the CDA file validation. So that's what we've been talking about in this presentation. So it's part of the CMS PI program process. It only validates that the CDA files pass NHSN business rules. So the correct drugs are in the file, all required fields are there, but that process is not going to validate the data that are in the files, obviously, since you can send fake data to us. So that's just making sure that the CDA files pass the business rules. And then lastly, we have the vendor software validation. So there are 3A here, NHSN validation, also known as SDS validation, validates that the vendor software can correctly apply the rules of the protocol. And again, that's required for all vendors submitting AUR data to NHSN. And 3B is the ONC certification. So that validation checks that the vendor software can generate CDA files that meet format requirements. And again, that's required for all vendors as well. So you can see that we have many different types of validation and each serve a unique purpose. My hospital submits AU data to NHSN. Do I need to send AU test files to receive a letter saying my facility completed validation? Yes, all 3 files are required in order to receive that letter saying that you've completed validation. So we can't send the letter until we have all 3 file types so that we've confirmed that all 3 are correct. If you are reporting production data for AU, but you're still in the pre-production and validation stage for AR, you would complete the steps for option 1, and that's what you would attest to as your overall level of engagement for the measure. So that means you complete the registration and then you work towards sending those 3 files for all of the 3 file types in this calendar year. So my facility plans to attest to option 2. Why did I receive an email from NHSN asking for test files? Because remember, we said you could skip the test file part if you're doing option 2. So all facilities will receive an automated request for test files. So the NHSN application will automatically send 2 emails when you register your intent to submit. So the first one comes immediately after registering. The second one will come roughly 30 days after if you haven't submitted those test files yet. The bottom line and most important thing to remember here is that if you plan to attest to option 2 and send production data, you do not even need to reply to these emails asking for the test files. You can simply ignore them. A little bit more about the request for test files. Again, you can disregard those emails completely if your facility intends to attest to option 2. If you're attesting to option 1, then please respond to the request for test files within 30 days. And the most important part here is failure to respond twice within your EHR reporting period will result in the facility not meeting the measure. So what happens if you don't have those test files ready? Not a problem. You can send a status update via ServiceNow ticket or email directly to nhsn@cdc.gov at least every 60 days until your hospital has the test files ready. So if you are registering today, you'll get that first email that says, please send the test files. And then you'll get another email roughly April 18th-ish asking for the test files again. If you don't have them, you can just email your status update to us and let us know what you've been working on and when you estimate having those files available. Okay, so when do facilities need to complete the steps to attest to option 1, pre-production and validation? So the timing varies here. So the registration has to be completed within 60 days of the start of your EHR reporting period. And remember, if you don't know your EHR reporting period, you're going to reach out to the quality reporting folks or the C-suite, some C-suite members to determine that for 2024. because you're going to need to reply to us. If you don't have those test files available, you're going to send those status report emailed updates at least every 60 days so that you don't fail the measure. And again, if you'd like a letter saying that the validation is complete, we're asking that you submit your test files to us no later than November 1st of 2024. That allows our team enough time to process the files. So let's talk through an example timeline here. So let's say facility A designates March 1st through August 31st as their 180-day EHR reporting period. So in this case, the facility has to register their intent within NHSN by April 30th, since that's within 60 days of the start of their reporting period. And if they want to receive a letter back from us showing they've passed validation, they need to send those test files no later than November 1st. If you have the test files ready sooner, no need to wait. You can send them as soon as they're available. But again, this calendar year, you're essentially working towards the generation of those test files. So if you don't have them ready, you're going to at least every 60 days, send an email with your status update to maintain your active engagement status. So when do facilities need to report AUR data to attest to option 2, validated data production? You need to report your data into NHSN no later than January 31st of 2025. So as we've previously mentioned, data should be reported monthly during your EHR reporting period. And NHSN will automatically send out the status letters on the first day of every month showing those yeses and nos for the months and file types that you've submitted. The final annual letter for the calendar year is going to be sent out on February 1st, showing your previous year's submissions, which means that's why we ask that all AUR data be submitted to NHSN no later than January 31st, 2025, in order to be included on that annual report sent by NHSN to facilities on February 1st. So let's walk through an example timeline. So facility B designates July 1st through December 31st as their EHR reporting period. So they're going to register their intent within NHSN by August 31st, the latest. Again, that's within the 60 days of the start of their reporting period. Then they're going to report their production AUR data from July through December on an ongoing basis. So NHSN recommends sending the month's data within 30 days following the completion of the month. And most important here, that facility is going to make sure they have their December 2024 AUR data submitted into NHSN by January 31st, 2025, because on February 1st, that annual report, essentially the data are frozen in that annual report. Any data uploaded after January 31st, 2025 is not going to be reflected in the annual report that NHSN generates. Do the quarterly CMS Quality Reporting Program deadlines apply to the AUR module reporting for the PI program? No, these are two separate CMS programs. So the AUR measure within the PI program does not have quarterly deadlines. As we've already mentioned, the AUR reporting is completed on an ongoing basis, and facilities are going to attest within the CMS HQR system about their AUR status just once a year. Let's do the last day in February of the year. Does CDC and NHSN provide data to CMS? No, the AUR measure is attestation based, so we do not provide any data to CMS for this reporting measure. Again, the goal of the PI program is to increase interoperable healthcare data exchange. So you, as the facilities, are going to attest to CMS that you are in active engagement with us to report your AUR data. And again, those attestations are completed within the CMS Hospital Quality Reporting System. We simply provide your facility with documentation to use as proof in the event that CMS were to audit your active engagement status. So when and where do facilities need to complete the PI program attestations? Again, the attestations are completed within the CMS HQR system. So they're completed just once a year for the previous year, due on the last day in February. So as an example, The facilities are going to submit their attestations and other PI program reporting for calendar year 2024 by February 28th of 2025. And again, that date is subject to change, but CMS will communicate any changes about that. The PI program measures are included, all CMS PI program measures are included in the reporting and attestation process. And I highly recommend taking a look at the CMS PI program resource library for more information on the attestation process. Where and how do facilities get documentation of active engagement status? So for option one, those folks that in the pre-production and validation phase, first, you use the email that says you've successfully registered and the invitation to send test files. That email is sent to the NHSN facility administrator and any of those optional PI program contact users. And then second, you can use either the email that says your test files have passed validation or the emails that your facility sent to NHSN as your status updates in the event that you're still working on creating the test files. And for option two, validated data production, you're going to use the monthly email showing your AUR data submission status. Again, that's sent on the first day of every month. And the annual letter is generated on February 1st of each year. Or you can use the ad hoc letters that you can generate at any time as the facility administrator using the link on this slide. So how do facilities figure out their active engagement status? So we got a lot of these questions the last couple months as facilities were trying to figure out their status for calendar year 2023. So I tried to come up with a flow chart to help walk through the logic for the active engagement status for 2024. So let's say maybe in the case of exclusions. So did you register intent to submit your data? Maybe no. Does your facility qualify for an exclusion? If not, if you don't qualify for an exclusion, then yes, you have to complete the registration of intent. So go back to the registration of intent square. If you do qualify for an exclusion, confirm that exclusion with CMS and you'll report that exclusion in the CMS HQR system, January and February of 2025. So let's say you're option one, you don't have production data, but you have test files. So did you complete the registration of intent? Yes. Did you submit at least 180 days of production data to NHSN? No. Okay. So did you submit test files to NHSN for validation? In the event that yes, you did, then you would attest to option one, pre-production and validation. A little bit more complicated here. Let's say you don't have production data and you don't have test files ready yet. So in this case, you completed registration, you don't have your 180 days of production data, you don't have your files yet, but you have to submit those test files for validation if you want that letter saying that you've completed validation from us. So if you have the test files ready, you send them to us. If you don't have test files ready, you send us those status updates at least every 60 days. And as outlined by CMS, you're working towards the creation and sending of those test files this calendar year in 2024. So if you're actively working towards creating those test files for 2024, you can attest to option one, pre-production and validation. Let's say you have production data, but it's outside of your reporting period. So you've registered your intent, you submitted 180 days of production data, but those maybe your EHR reporting period is, let's say, January through June, and you didn't have your production AU data ready until July. So you reported July through December data, but that's outside of your facility's reporting period. Not to worry. You would just send your files to NHSN for validation and complete that validation step. And then you would attest to option one, pre-production and validation for this calendar year. And then you'd move to option two next calendar year. And then option two here, you've completed registration of intent, you've submitted at least 180 days, and those 180 days are within the facility's EHR reporting period. So yes, your facility is going to attest to option two, validated data production. So where do I find out more information on what data are reported to the AUR module? So we have a lot of great resources today. I didn't have enough time to barely touch upon the surface of what data are actually reported for AU and AR, but you can find a lot of great resources on our web pages here. So I have the link for our AUR module webpage, which is kind of the starting place for all of our materials. We have the protocol, which is very detailed and walks you through all the numerator, denominator, as well as the metrics and the required drug value sets, for example. And we have a lot of already recorded and posted training webinars. So I'd highly recommend going to our AUR module training if your facility is just starting out on this journey for how to report AU and AR data. Go to the trainings page and take advantage of those more detailed AU and AR specific trainings. And I wanted to share the screenshots of what those trainings look like. So we have lots of trainings available separately for AU and AR. You can find specific trainings on reporting versus analysis, both beginner and advanced analysis. You can learn more about our risk adjusted metrics as well. So please check out those recorded trainings. You can listen to them at any time. You can find additional PI specific resources available on our webpage as well. So we have some operational guidance. We have the slides from last year's training session, which will be replaced by this session. And then most importantly, we have a lot of FAQs available. So we try to keep those FAQs updated. So we'll be updating them within the next few weeks, hopefully with all the great new information provided in this training as well. Maybe you have questions for CMS, or maybe you've asked a question in the Q&A and the team has replied that you need to reach out to CMS. So in those cases, you can submit your questions directly to them at the ServiceNow tool. They have ServiceNow as well. Or you can email or call the CMS help desk at qnetsupport at cms.hhs.gov, or call the number listed on our slide here.